Good evening, everyone. On behalf of Caregiver Saathi, I extend a very, very warm welcome to everyone who's tuned in to listen to this conversation this Thursday evening. Humanizing Our Healers. It is an initiative by Caregiver Saathi where we are aiming to highlight how human our healthcare professionals are. And for today's conversation, I have somebody whom I very fondly call my friend. We've had some good times together. We've had lots of dance practices. We've danced together. We've gone out together. We've gossiped together. And she's been there whenever there's a medical need also. So I extend a very, very warm welcome from the entire team to Dr. Manjiri Amin Kaba. Welcome, Manjiri. It's a pleasure to have you here.
Thank you, Vandana. Thank you so much.
For our viewers, can you please tell us who Manjiri is?
My name is Dr. Manjiri Kaba. I'm an honorary consultant obstetrician and gynecologist working at Saifee Hospital, Prince Ali Khan, Masina, and Wockhardt. Basically, it's most of the South Bombay hospitals. I am also a mother of two. I have two daughters, now 12 and 16. My husband is a pediatrician too. So we are like a nuclear family at present. My parents live in Bombay. I've been brought up my whole life in Bombay. So I'm like a total Bombayite, as you call it. That's about, I love painting. So if you see my wall, my kids have painted their wall. So that's how our whole house is full of artwork. You should come, Vandana.
Yes, I haven't. Can you imagine? I've never visited her house, but then yes, that is one thing on the agenda now. Thank you, Manjiri. Thank you so much. And Manjiri is a wonderful human being, and that is what I'm trying to highlight through this conversation. She is a fantastic doctor, no doubt, but she's a wonderful human being, as human as all of us and everyone who's listening in today. So, Manjiri, last year and a half has been very tough for everyone. And for doctors, it's been exceptionally demanding. So, can you take us through how the last year and a half has been for you as a family, professionally and personally?
So, I think it all started in March, when my daughter had her 10th exams going on. She was in ICSE 10th standard at that time. They had finished a couple of papers and a couple of papers were left, and us parents were like standing outside and talking about how this pandemic is going to come, and there are the cases have started in Pune, and whether it's going to affect us or our kids and all that. And little did we know at that time how badly it would affect us and how badly it will affect our country, our city. The kids were stressed about exams, and suddenly one fine day they had announced in the evening that exams are all postponed, and the kind of stress that the 10th standard kids went through, it was really bad. That's when it actually all started, and then slowly, I think hospital after hospital started shutting down, like dominoes. First, I'm attached to all these higher end hospitals, Saifee and Masina and all that. All of them started shutting down one by one when they started getting positive cases, because nobody knew how to handle it. There was absolutely nobody was prepared for it. The infrastructure that we have, we were not able to contain the spread of the disease. So it was really not only scary, it impacted a lot of lives, not just patients, but doctors as well. For us, each and every hospital we were attached to were slowly. So we are all honorary consultants. We are not on a payroll. So suddenly there was sudden loss of income, besides the fact that, the scare of the disease and our patients. A lot of my patients had to run here and there because the hospitals would shut down. There was no infrastructure to take care of COVID positive deliveries at that time. because I'm an obstetrician, most of the time my patients who come in emergency are pregnant patients. So I had to arrange for, other places for them to go, and it was really tough at that time. Besides the fact that my daughter's exams were postponed, she was under stress. My parents were living with me. My father is almost 80 now. My mother is 76. At that age, it's really scary, with having them with me. They usually live in Bandra, but at that time they were with me because when my kids have exams, they come and stay with us. So it was not only work, home, my kids. It was a little overwhelming, at that time. Once the hospital started, they formulated a plan and they started working, and we started going to work. Of course, we took all precautions. There was scarcity of PP suits. There was scarcity of the N95 masks. We had to arrange for those, and we had to, because we are private consultants, so we have to arrange for our own things initially. So we had all that in place, and then slowly we started work. Before we started work, I was a little anxious about, my parents being with us. At that time, it was lockdown, so I didn't want to send them back as well, because I don't know who would take care of them. And I told my parents, I'm going to start work now, and there is a chance that, we need to make sure that you guys are safe. So what my dad said really, struck a chord with me. He was like, I'm almost 80 now, so if I have to go, I will go, and as long as I'm here with you, I'm happy, is what he said. And that really, it was an emotional time for me. Then we did start work, and then we tried to make sure that we wouldn't, my parents and my kids wouldn't contract it. So we had stopped hugging the kids and kissing the kids, and it was a very emotional time for the children as well, because they're so used to. I have girls, girls are so emotional, and Vandana, you have a daughter as well. You know how they are. They just want to come and hug you the minute you're in the house. So that time, it was a very stressful time, not only for us, for the children and my parents as well, because we try to isolate ourselves, because we didn't want to infect them. We try to stay away in our room and have them live a little separately. But how much ever we tried, I think something went wrong, and we all got infected in the first wave. Not only me, Amin, but my children and my parents as well. And I can't tell
What
you how
scary.
scary that was. Yeah,
Must have been such
it
a
was.
scary time
It
for
was.
all of you.
Yeah, it was so scary, because first I think my mother fell ill initially, and then my dad. Then I think we were like all six of us were down. And when we got ourselves tested and became positive, it was like, I think, one of the most horrifying and scary experiences that we've ever had. Then we started the medication, and we monitored our temperatures and our oxygen saturations and all that. And we requested the government people they were really good. They came home and they checked on us, and they would have, at that time, they used to admit everybody, right? But we requested them to let us stay at home, because we were there to monitor. So they allowed us to stay at home, and we were all, and they would call every alternate day to check on us, which was really good. Uh, but it was scary.
Yeah,
Yeah.
and also, Amin and Manjiri are the go-to people, the go-to doctors in the building. We can call them anytime, anything, forever. We just pick up the phone and call them. To see the entire family down with COVID was very distressing, not only for them, for us also, because they're such wonderful human beings. So what I'm trying to, tell the viewers here is, they are doctors. Doctors go to hospitals which are the hub of infections. And howsoever they may try, they do get exposed. And that fear with them is looms around them. Even now, I'm sure, Manjari, when you go out, to the hospital to work, children back at home, though you've all had it once, but that fear stays, right, Manjari?
Fear stays, yes.
The fear
It does.
stays. So how tough it is. And for us, non-medicos, we worry about going out and catching the infection. These guys go out and they have to operate, they have to interact with, infected patients. And for Manjari especially, delivering babies. And that also, like she said, right during the peak of COVID, must have been so demanding on you, Manjari.
Very often, I would examine a patient and then send her off to the hospital for their checkups, and they would come COVID positive. Uh, it's almost, I think, 8 out of 10 times in the first wave. Uh, that was the scene. So I guess probably we got it that way.
Okay. Thanks for sharing that, Manjari. And when you talk of your dad saying what he did, gives me gooseflesh. It is so makes me so emotional. Knowing about our parents and how they want to be with us. But during COVID, we also worry so much for them, Manjari. I haven't seen my mother for almost a year and a half. She lives in Delhi, and I'm just dying to go see her. I'm hoping that things remain okay and I can go see her. Um, Manjari, when all this was going on, so much going on, professional front, personal front, you guys falling ill, parents also not, they are aged parents. It must have been a huge emotional toll on you.
Totally. And the problem was that because all of us were ill, Amin was more stressed, and that is why probably his fever wouldn't go for 10 days. So one fine day we decided that he should at least get himself tested. And the problem was I couldn't drive him because we were in quarantine. He had to go alone. We had to call for an ambulance, and he went all alone in the ambulance to the hospital. There he was examined by a very good personal friend of ours, who is an intensivist at Wockhardt, and his HRCT was done, which showed positive signs, and by that time he had a very bad cough as well. But we had not expected that he would admit him. But the minute he saw, he called me up, Dr. Kedar, and he said, Manjiri, I can't send him home. And that was like a shock for me, I was like, oh God, what do you mean? He said, no, his score is too high, and his saturations are not great. We need to admit him. And I was numb, for a second. I couldn't think straight. I was like, it was, I think those 5 days that he was in the hospital, they were like the worst days of my life, because it was, and kudos to my daughters, because they were strong through it. They saw how I was, and they were completely, not a single tear shed till he was back. Okay. Then they were like, but luckily, by God's grace, he was cured. Whatever they did, the remdesivir and whatever worked, and he was back home.
Thank God for that. And thank God you guys are here as our friends and as someone we can reach out to. I think Manjari is back. So Manjari, it's been so emotionally exhausting, emotionally demanding for the entire family. When Amin was back, and when the fear was kind of kept aside, what did you guys do? I mean, there must have been some ways that you followed, or something that you did to forget what you went through and cope up with the.
No, Vandana, you can't forget it. It's impossible to forget it. But we started this routine of all 6 of us, of regular exercise, diet. We would do yoga and meditation. The girls would cook. My mom was here. I'm not such a great cook, but my mom is a wonderful cook. So my mom taught my girls how to bake, and they passed their time that way, and they really enjoyed that. I did a lot. I caught up on my painting. I would just sit and paint whenever I had time. Of course, when I had to go to work, it was not that easy. But whenever I got time, I used to paint, and that is a huge de-stress for me. As long as I can remember, actually. So
Sure.
we did that. We played games with the children.
Hmm.
A lot of games, board games and other stuff.
Yeah, 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 and quarantine is so difficult, and especially when the entire family is just cooped up
Yes.
inside the home. But then I guess you found your ways to deal with it.
Yes.
Um, Manjari, I also want to know that at any point, did you ever feel that, oof, this is all too much? I can't take it.
The night Amin was admitted.
Yeah,
Yeah.
is
Those
that?
5 days, I couldn't sleep. I couldn't eat. I just it was like I said, the worst 5 days of my life. The
And I
night
was just,
I got admitted was, I think, the worst.
mm,
I think technology has been great now because we can video call, and we can talk to the person, which was not possible earlier. But even though you can see the person, you can speak to the person, you're still never sure. You're not with the person, right?
right.
So
And you
that's,
don't know, what's happening inside. When I was admitted, so I know,
yeah.
family, though they pretend it's all okay, but that fear doesn't go away.
Fear
So
does.
for that, when I meet you, I'm going to give you a big tight hug for whatever what you went through. Okay. Manjari, anything that you would like to wish for as a medico for the future?
Wish for the future. I would wish for Corona to go away.
And for Corona to
Yeah.
go away. Yeah, I hope so. I hope so that happens, Manjari, at some point. Um,
Yeah.
yeah. And
I
any.
wish, I'll tell you, sorry,
Mhm,
let me not cut you. What wish for is more time with family, because
mhm.
now we realize what we are going through. They are actually sacrificing for us all the time. When we step out of the house, it's the children who are, um, you know, letting us go. um, and we take our freedom too much for granted, I think. Freedom to move around, to leave the house, to be able to just walk on the streets. I think we take all of this for granted. Um, no amount of money in the world gonna, be enough to, to is gonna be able to restore a life. So
Absolutely.
I guess
Yeah. So
you
for
have
the
to all be aware of that.
absolutely, and for the viewers, can you feel how human she is? Do you realize how much they have gone through too while they are there looking after us? Their own personal lives have also been impacted so gravely. So my heart goes out to them, and also I'm grateful that Manjri, Amin, and their daughters and Manjri's parents are all okay. And we are going to have fun once again very soon. Manjri, message to the people that you would want to give out.
Um, Firstly, Corona is not gone yet. Okay, and we really need to make sure that we follow COVID appropriate precautions, because yeah, we still haven't, we still haven't conquered it, and it's going to take a long time now. So the hand washing, the wearing of the masks, all these are really, really important things that we need to follow. And also, uh, we doctors are also human beings. We are also daughters and wives and, uh, mothers, daughter-in-laws. We also have, uh, we also have a human side. So when just you have to trust us, and you have to stay with us. And I think uh, it's very, very important that each and every one gets vaccinated, so that the chances of us being able to control this pandemic will be much higher than it would be otherwise, right?
Yeah, absolutely, Manjri. And it's so important for everyone to realize the importance of vaccination. Get vaccinated so you are safe, and the demands and the workload on our healthcare professionals is also brought down, because there is so much that they can do. And like Manjari said, please follow COVID appropriate behavior. And Manjari, I also want to talk about, you've spoken about, what a big toll on the emotional well-being it is for the medical fraternity also. So would you just like to talk a little about that, Manjari, about mental health of the medicos?
Yeah, because um, I work in hospitals where they were they had COVID wards, and a lot of our residents would would be in rotation, go to the COVID wards, and I'd seen that a lot of them would undergo a lot of emotional upheaval. You know, in fact, one of my residents lost her father to the pandemic. Despite all that, she'd come to work with a smile on her face, and it was very heart rending to watch the way they work and the way they have to deal with patients at the same time. Uh, Dealing with patients is still all right. Dealing with the relatives is really scary, because all the time you're questioned. Every treatment, every injection that you give, every word that you say is uh, is questioned, which is sad because all the doctors are always looking for the well-being of the patients all the time, and this is a new disease. It's nobody really knew how to treat it. So it's you need to uh, trust your doctors and let them follow whatever protocol they're able to, and that is available at present. And we just try to save your lives. We're not trying to, you know, uh,
Sure, absolutely, Manjri.
yeah.
And pardon the phone ringing in the
So
background. The phone is constantly ringing
yes,
in the background.
yeah,
So, can you hear me now, Manjri? Am I audible?
hello, Vandana.
Hello.
Yeah, I lost for a second.
Okay, all right. My apologies. My there's somebody at the door and my dog is barking. So please apologize. My apologies for that. So yeah, just give me a minute, please. I'll just be back.
Yes.
My sincere apologies for that. Thank you for waiting on Manjari. And towards the end, I would want to know a little about some anecdotes or fun moments that you've had in the last year and a half.
Fun moments. The day we got infected, our report came positive. We ordered pizza, which was fun because I think for so many months we were not ordering outside food. The kids really loved it. Um Also, a lot of my infertile patients became pregnant in the pandemic. I think that was maybe not fun, but that was great for me and for them. Um, yeah, there is one episode I'd like to talk to you guys about. I usually, when I operate patients, when when my anesthetist gives them an anesthesia, I tend to hold their hands and I tend to, counsel them and tell them to, sit straight, not move, and stuff like that. So there was this patient who was a little, hello.
Yeah, Manjari, I'm
Yeah,
here.
yeah. So there was this patient who was a little uh, anxious, and she would jump every time she felt the needle and going in her back. Uh, so I try to counsel her, and I'd hold her hand and put my
Yeah.
hug her a little bit and tell her it's all okay, don't worry, it's not gonna hurt. And she'd say, no, no, I know you're lying. So, and she every time my anesthetist put the needle again, she'd jump. So this anesthetist is a very, very dear friend of mine. So he said, Manjiri, get out. I was like, what is this? Why are you kicking me out of the OT? He said, just get out. So okay. And I just left the OT and I said I might as well wash up. So I washed up and all. And by the time I came back, she was all anesthetized and lying down and she was all, painted and draped and ready for me. And I said, how did you work this miracle, Swapna? So he was like, Manjari, do you realize that when the mother is around, the kids are never cooperative. So this was like in the middle of the pandemic, and we were all in these PPE kits and all stressed out at the same time. Yeah, this patient didn't have a report. COVID report yet, so we were all in PP kits and we were all trying to, stay calm and so this was like one of those incidences where
Yeah, it makes me laugh when I think of it. For you to be there and going through it
so,
so hilarious, Manjari.
so he said the minute you left the room, she was fine.
So that's what they do. Now when the mothers are around, why children throw
Why
that?
children are, yeah.
And from that, viewers, you can also make out the kind of wonderful person Manjari is. So thank you for being such a warm, lovely, kind human being, Manjari, in addition to being a wonderful gynecologist. From the entire team of Caregiver Saathi, I want to wish you, Amin, your daughters, and your parents all the very best. May you all remain happy, healthy, and may our friendship just get stronger. Thank you for being here, Manjari. It was a pleasure hosting you for this conversation.
Thank you so much, Vandana.
And yes, look forward to seeing you in person very soon.
Yes, definitely.
Thank you, Manjari. Thank you for being here from the entire